Hi, Dr.
Okay.
Asti.
Hi, Gabby. Hi. How are you?
Hi, I'm good. How are you?
Good,
Hi,
good.
everyone. Thanks so much for joining. So, the topic of our live this evening, as you can tell by the title, is fertilization in IVF. Before we dive into the questions, Dr. Asti, could you please give a brief introduction on the topic?
Yes. So today we will be discussing fertilization result or fertilization check. So in previous live stream we discussed actual insemination, whether we should use IVF or ICSI or split IVF or ICSI when we do insemination. So then on today's live stream we will discuss fertilization result or fertilization check. So, okay, what happens is when we do IVF, so you have a period, then we do injections for 10 days, monitor your ovaries by doing ultrasound scan and blood tests to check how many follicles responded to stimulation. Then approximately after 10 days, you have a trigger shot for maturation of the eggs and you have egg collection. So then once you had egg collection, all these collected eggs will be inseminated either by IVF or ICSI. If you have ICSI, then the surrounding cells will be removed, and then you pick one sperm for each egg, each mature egg, and inject the sperm into the egg. So on that day, you may see some immature eggs like GV or M1 eggs, and those eggs you discard. And then all mature eggs, which are M2 eggs, you inject with the sperm and leave for fertilization. So if you're doing IVF, you take the eggs, then leave with the full in the petri dish with the sperm overnight without removing the surrounding cells, and after 16-18 hours check for fertilization. So essentially next morning, which is 16-18 hours after your egg collection, embryologist checks the fertilization result. So in the fertilization result, if you're doing IVF, so then you remove the surrounding cells, you look directly onto the eggs, on the surface of the eggs, and you can tell whether these eggs are fertilized or not, whether there was some immature eggs. So then immature eggs, unfertilized eggs, or abnormally fertilized eggs will be discarded, and healthy fertilized eggs will be put in the incubator to grow those eggs, fertilized eggs, now called embryos, until blastata stage before for day 5 transfer or freezing of embryos on day 5 or day 6. So yes, so a fertilization result means that how many of those mature eggs fertilized successfully. So we will be discussing this during live stream. That's a very critical milestone and critical indicator of your success in IVF.
Thank you so much, Dr. Asti, for that introduction on the topic. My first question is, what kind of eggs do you see in a fertilization check?
Okay, so in fertilization checks, let us say if you do ICSI, you already see the maturation or maturity of the eggs on the day of egg collection. 2 to 4 hours after the egg collection, when you remove the surrounding cells, you can directly look at those on the surface of the egg, and you can tell which eggs are immature and which eggs are mature. So immature eggs get discarded, so on the day of egg collection, and only mature eggs are kept and inseminated with the sperm. So that's why in IVF we cannot tell which eggs are mature or immature on the day of egg collection, and we will find out which eggs are immature or mature on the day of fertilization check, which is the next day after the egg collection. So essentially, whether you check on the day of ICSI, which is the day of egg collection, or on the day of fertilization check, so you can have a different level of maturation of your eggs. So you can have immature eggs. They are called GV, germinal vesicles, or they're M1 eggs. So metaphase 1, or they are actually abbreviated on your embryology chart as a GV or M1. That means these eggs are immature and they do not have a chance to become embryo, and these eggs need to be discarded. You cannot use those eggs. Then you have a mature eggs. These are M2 eggs. So the M2 eggs are eggs which gone through the maturation and ready for the sperm to penetrate and inseminate and make an embryo out of M2 eggs. So essentially, when you do fertilization check, for example, after doing IVF, you see immature eggs, mature eggs, normally fertilized eggs, and abnormally fertilized eggs. So you get four category of eggs on that day, and also fifth category is degenerated eggs, which eggs broken down and you can't use them. So degenerated eggs, immature eggs, mature eggs but not fertilized, normally fertilized eggs, and then abnormally fertilized eggs. Of course, we can only use normally fertilized eggs. So yes, so in terms of M2 eggs, when you check on after the IVF, so you can see M2 eggs which didn't fertilize. So that's unfertilized mature egg. So then you see normally fertilized egg, which is we call 2PN. We actually want 2PNs. We want a lot of 2PNs when we do fertilization check. 2PN means that one egg, one cell inside two nucleus. One nucleus is a maternal nucleus, and second nucleus is paternal nucleus. So one is from sperm, one is from the egg. That's perfectly fertilized 2PN egg. That's what we want. So then you can have abnormally fertilized egg. That's 1PN, which means there's only one nucleus, either sperm nucleus or egg nucleus, or they merge together. You can see merge together one single nucleus. So that's abnormally fertilized eggs. There's some reports you can use them, but generally we don't use them. We discard, because likelihood of getting successful pregnancy using from 1PN eggs are very, very low, and also you have to do various testing to check those embryos. So generally 1PN eggs get discarded. In future, maybe with the new technologies, you can do more testing and start utilizing them effectively in clinical practice. So essentially we want 2PN, and then you can have a 3PN eggs, which means the additional nucleus. So you have got maybe two nucleus from egg and one nucleus from sperm, or two nucleus from sperm and one nucleus from egg. So in IVF, it's very likely if you have a 3PN, that's two nucleus from sperm, which means two sperm entered. It's called polyspermy. So normally what happens when you do IVF, first sperm enters the egg, and the membrane or the surface of the egg becomes very hard and doesn't let the second sperm to enter. But sometimes two sperm can enter, and then that can cause polyspermy. So in that polyspermy, you have got additional chromosomes. So that's too much of chromosome. That means those embryos will not be normal, and you have to discard those embryos. So in ICSI also you can have a 3PN. Here you can see actually the egg didn't throw away the one set of chromosomes during division, and it kept the additional set of chromosomes. The egg's chromosome is 46, and plus you have got 23 sperm chromosome. That's normal. You should have a 46 chromosome, 23 egg, 23 sperm chromosome in 2PN. That's healthy fertilization. So yes, so yeah, on the fertilization check, only 2PNs are kept. These are normally healthy fertilized eggs, and they're incubated till day 5 for transfer or freezing. So all immature eggs get discarded, all abnormally fertilized eggs get discarded. And also that day, very critical, also the embryologist calls the patients, and they tell how many eggs were collected, how many of those eggs were immature, and if it was ICSI, how many eggs were inseminated, and how many eggs normally fertilized and put in the incubator. So that's called fertilization check and the fertilization call by embryologist.
Thank you so much, Dr. Asti. That was really interesting, also learning about the different egg types that you see in a fertilization check. My second question is, what is a normal fertilization?
Yes, so normal fertilization, like we said, the 2PNs. So in terms of fertilization, normal fertilization in the egg level, that's 2PN. But we also call normal fertilization how many eggs fertilized. So normal rate of fertilization, that's called fertilization rate. So normal fertilization rate is more than 75%, which means when you check the fertilization rate, you don't look all total eggs. Let us say you got 15 eggs and you have got, let us say, 8 fertilized. You don't look at the 10, 15 eggs. You just look at the only M2 mature eggs which didn't fertilize or fertilize. Let us say, for example, you got 15 total eggs on the day of egg collection. Out of this, you had 5 immature or abnormal eggs. Then you had 10 mature eggs. That's M2 eggs. And you got 8 fertilized. That's normal. So 8 out of 10 mature eggs fertilized. That's normal. So more than 75% of mature eggs, M2 eggs, should get fertilized. That's called normal fertilization. If you have a less than 75% of mature eggs fertilized, that's called low fertilization.
Thank you, Dr. Rusty. Speaking of low fertilization, what is the cause of low fertilization?
Yes, so in terms of low fertilization, you can have a just simple low fertilization that's 75 to 25% fertilized of mature, or very low fertilization, which means less than 25% fertilized, or failed fertilization, none of the mature eggs fertilized. Let us say you got 15 total eggs, 10 mature eggs, 8 fertilized, that's normal. Or if you have got like 3 to 8 fertilized, that's low fertilization. So if you have got only 2 fertilized, that's very low fertilization out of 10, which is 20% fertilization. That's very low. If none of the mature eggs fertilized, that's called failed fertilization. You don't have any embryo to grow. So, and depending on level of fertilization, you can have a different causes. So generally, the fertilization of mature eggs is a function of sperm. Generally, it's sperm's role to fertilize mature eggs. When fertilization is low, generally we assume that's actually sperm quality or quantity or binding to the egg was problem. So generally, but of course, I will explain some situation. Actually, it may be mainly due to egg maturation, or maybe due to egg quality as well. So generally, that's sperm. So in terms of low fertilization, first thing we'll look at is whether we did IVF or ICSI. If we did IVF, we look at the binding of eggs and sperm onto the eggs. So when you do IVF, next morning when you check, you should see a lot of sperm bound to the surface of the eggs, and hopefully one sperm entered, and you have 2 p.m. So if you see a lot of very good binding and still low fertilization, it may be due to egg quality, sperm quality. Sperm might have been healthy enough to bind, talk to the eggs, but didn't have a capacity to fertilize the egg. That's very likely cause. Then we look at the sperm parameters or male factor, previous baseline sperm analysis, and try and understand if there was a significant issue with the sperm quality. So, and the second reason may be due to egg maturation. So eggs may be mature, which is M2, nucleus of the egg may be mature, but the cytoplasm may not be mature. So which means if egg looks mature when we look at the microscope, but it doesn't have a capacity to accept the sperm and create fertilized egg or embryo. So this usually we can tell by looking at the monitoring chart. We look at the size of the follicles at the time of trigger, estrogen levels, and if the size of the follicles were too small, then we assume that in this patient actually they need extra time for maturation next cycle. Or if there's a sign of FSH or LH receptor problems, despite having good size follicles, good estrogen, you can still have immature eggs. Then you need to change the stimulation protocol, use different FSH, different trigger, longer stimulation, maybe change of regime to improve the maturation of the eggs, and as a result to improve also quality of the eggs and capacity of eggs to accept the sperm. So in the blanket rule, just in generalization, we assume it's usually a sperm's problem, but it can be due to egg maturation or even egg quality problem. It can be due to egg quality problem if, especially in patients, in older age patients, where eggs, due to poor quality, they can't handle the stress of fertilization. So they do not have a very good capacity to go through because fertilization is a critical milestone. That's phase transition in the eggs, and that may be too stressful for poor quality eggs to go through. So so we looking at the chart and overall background history, baseline fertility, normally we are able to tell what could be the reason for low fertilization.
Thank you so much, Dr. Rusty. And what is the cause of a failed fertilization?
Yes, so failed fertilization is not common. Maybe less than 5% of IVF cycles, you can see failed fertilization. So again, failed fertilization can just happen just because egg quantity was so low. Let us say you had five total eggs and there was only two or three mature eggs and none of them fertilized. That may just happen by chance, which let us say, for example, if you have 10 eggs and three doesn't get fertilized, two doesn't get don't get fertilized, it is still normal fertilization because you had so many eggs, eight got fertilized. But if you have only two mature eggs, if they don't get fertilized, it may just happen due to chance because overall, if sperm quality is not optimal and if egg maturation is not optimal and egg quality is not optimal, then none of those eggs may be able may fertilize. Let us say you got two eggs, inject two sperm, and let us say by chance, healthy egg might have been injected by unhealthy sperm and vice versa. So you have got one egg, healthy egg, and one healthy sperm, but the matching was wrong. Whether you do IVF, naturally when sperm randomly enters, even healthy sperm randomly enters egg, and that sperm might not have been normal, and that sperm might have entered healthy egg. But you had unhealthy egg, which might have been inseminated by healthy sperm. So there's a mismatch that can happen randomly. So there's a lot of lack factor in IVF or even in fertility. So a lot of random and luck factors. So and if you have a large number of eggs, it's very unlikely it happens. So and failed fertilization can also happen because of sperm binding if you have a large number of eggs. So or you can have it due to poor maturation of eggs or poor quality of eggs.
Thank you, Dr. Rusty. My final question is, how can you improve fertilization in the next cycle?
So main thing is to identify the cause. Let us say if you did IVF and you had poor binding, certainly next cycle you should do ICSI. If there was issue with sperm quality overall, then of course if you are not already using, you need to use microfluidics like Zymote type devices to select better quality sperm and remove the sperm with DNA fragmentation. For example, if you use microfluidics, you pretty much eliminate sperm with DNA fragmentation, and then you use healthy sperm. So, and overall, if there's a very poor lifestyle, heavy smoking and very poor lifestyle, if male significant poor lifestyle of male side, increased body weight, then you should of course address those issues as well. If you have a low fertilization due to egg side, like maturation problem, then you need to improve the maturation by changing stimulation protocol, and as a result, you can improve the egg quality as well. So yes, first thing is to identify the cause of low or failed fertilization, then address those causes directly.
Thank you so much, Dr. Rusty, for that really insightful live. That does conclude my questions for the topic of the live this evening on fertilization check in IVF. As always, the recording of this live will be published to Dr. Rusty's social media channels on TikTok and Instagram. The topic of our next live will be embryo development. So if you are interested in learning more about that topic, please jump on to that live same time tomorrow evening. Thanks so much, Dr. Rusty.